assigned to a 35-year-old male at home. He's complaining of headache, nausea, and dizziness. His spouse mentions that a portable generator was running in the garage due to a power outage. The patient appears pale and slightly confused. Immediately, your scene size up is critical. Check for safety first. Carbon monoxide is colorless, odorless, and deadly. You cannot rely on sight or smell. Your senses may not detect it. Ask the right questions. Is there anyone else in the house experiencing similar symptoms? Or any fuel burning appliances in use? How long has the patient been in the environment? Look for clues around the scene. Running engines or generators indoors, smoke from furnaces, heaters, or fireplaces. Multiple people with headache, nausea, or confusion. So carbon monoxide binds to hemoglobin 200 times more strongly than oxygen. This prevents oxygen from reaching tissues, a condition called cellular hypoxia. The brain and heart are most sensitive to oxygen deprivation. Even low-level oxygen can produce symptoms. High-level exposure can be rapidly fatal. Some signs and symptoms include headache, nausea and vomiting, dizziness or confusion, weakness or fatigue, chest pain, shortness of breath. Severe exposure may cause altered mental status, loss of consciousness, seizures, or cardiac dysrhythmias. One big red flag, multiple patients in the same location with similar complaints. Your assessment, scene safeties first. Never enter an unsafe environment without protection. Conduct a primary assessment, airway, breathing, and circulation. Check vital signs and mental status. Consider pulse oximetry, but remember, your SpO2 reading may be normal even in carbon monoxide poisoning. Obtain a history, fuel burning appliances, vehicle exposure, smoke inhalation. Look for physical clues, a generator, a furnace, heater, or smoke smell. Your treatment, remove the patient from the carbon monoxide source immediately. Administer high flow oxygen via non-rebreather mask. Support airway, breathing, circulation as needed. Monitor vital signs and mental status continuously. Remember, transport to the hospital. Bring exposure details, source, duration, and symptoms. Severe cases may require hyperbaric oxygen therapy, which is a hospital-level care. So some key points. Carbon monoxide is colorless, odorless, and dangerous. Symptoms are often non-specific. Headache, nausea, dizziness. Your scene size up is critical. Check for clues, ask the right questions. Severe exposure can cause neurological or cardiac compromise. EMT priorities removed from the source. Give oxygen, monitor ABCs, and rapidly transport. In closing, carbon monoxide poisoning can be silent and deadly. Recognize subtle signs, perform a proper scene size up, ask the right questions, provide oxygen, transport promptly. Early recognition and intervention save lives.